Hello, and welcome to today's RateFast Speed Seminar. I'm Dr. John Alchemy with RateFast. Today we're going to be talking about the art of the QME, also known as a qualified medical exam. To start out, let's define a qualified medical examiner. This is a medical professional who's credentialed by the state to perform a specific medical exam for workers' compensation injuries. When the stakeholders in a non-represented case require clarification on some aspect of an injured worker's claim, they order what's called a QME, or a qualified medical exam. A qualified medical examiner is a provider who has sat for a specific test distributed by the state and passed. This is an administrative test and not a medical test. It's also important to point out here that the QME exam in no way tests the examiner's ability to understand or perform accurate impairment ratings according to the AMA Guide's 5th edition used in the California workers' compensation system. When an injured worker or an insurance company needs help in clarifying a claim, they order what's called the qualified medical exam. How this works is the injured worker is sent an information packet. Inside the packet, they need to choose the specialty for the exam they wish to undergo. Once the injured worker has determined what specialty they would like, then they are sent a list of 3 providers closest in their zip code. These providers are chosen at random, and the information for each provider is listed. When the injured worker receives the list, then they can choose a provider based on their background, their CV, etc. If they fail to return the information within a defined time period, then the carrier can determine which QME will be used for the process. This is a time-sensitive and driven process to ensure that things move forward properly. Once the injured worker has determined which QME they are going to use for the exam, they call the provider and set the exam. An appointment date is given. Once the QME office has received the call and the appointment date is set, a QME appointment notice form is completed. This is sent off to the insurance carrier and the injured worker. This triggers the insurance company to send the available medical record to the QME in preparation for the evaluation. Often, the QME will not be set any sooner than 4 to 6 weeks from the date of call to allow administrative processing of the chart. On the day of the exam for the first evaluation, the QME takes the history from the injured worker. They perform an examination. They make a determination on causation. They make a determination on maximal medical improvement, also known as MMI. If the injured worker is determined to be at maximal medical improvement, an impairment rating is carried out. The impairment rating is performed using the guidelines of the AMA Guide's 5th edition. Impairment ratings not only include standard what we call the 4 corners rating of the AMA Guides, but also additional rating considerations such as Alvarez-Guzman, Section 1.2 ratings which deal with 0% whole person impairment definitions, or patients who have activities of daily living disturbed but no chapter ratings, and finally Chapter 18 pain ratings. Following this, the concept of apportionment has to be determined. This is where the QME determines which aspects of the permanent disability are due to the actual work injury and which aspects of permanent disability are due to non-industrial, pre-existing, or subsequent injuries that are not related to the injury in question. In the apportionment, the QME must provide percentages of contribution to make the determination. And finally, if appropriate, any future care is outlined. That might be medications, therapy, access to diagnostic testing, or specialty and/or surgery needed in the future to care for the injured worker. Now, if you're thinking to yourself, this is a pretty tall order, you're right. Many QMEs are not familiar with all the details of the impairment rating and/or the apportionment process, and subsequently, the reports vary widely in accuracy and consistency. So let's talk a little bit about some of the challenges that face the qualified medical examiner. Number one, the process of the medical evaluation and the chart review. The chart review may include no notes all the way to several boxes of notes. These need to be systematically reviewed and entered into the report in a meaningful way that the stakeholders can see A, what information is available in the medical determination process, and B, what is the relevance to the medical determination of all of the elements in the QME case. The next step, as we mentioned, is determining maximal medical improvement. Maximal medical improvement simply means that the individual is at a level of recovery which is anticipated to not change meaningful in the next 12 months. In order to make this determination, the QME must decide if all available treatment has been provided and or accepted by the injured worker. If not, the injured worker is not to be considered at maximal medical improvement. It is only when the injured worker is at maximal medical improvement that an impairment rating can be performed for permanent impairment. Now, in cases where the individual has been found to be MMI, the QME must now open up the AMA Guides 5th edition in California and begin the impairment rating process. Now, the impairment rating process can be a very daunting event because it not only includes very specific measurements and the way that the measurements must be obtained, but it also entails the evaluator knowing what questions to put in the history in order to give the case context for the impairment rating. Any missing information can result in an inaccurate impairment rating. And the problem is the stakeholders have no way of knowing if the impairment rating data set is complete because the process is convoluted and difficult to understand. So in other words, when an impairment rating is delivered by a QME, it's often difficult for the stakeholders to know if it's accurate or not because they don't understand what information needs to be available to create that impairment rating. Remember, it's the accuracy of the impairment rating that will set the value of the claim. And again, if the data set is incomplete or inaccurate, the impairment rating will likely be incorrect. Delivering an accurate impairment rating is one of the most important functions of a qualified medical examiner. Stakeholders needing access to a tool that can check the accuracy of a qualified medical examiner's results are of paramount. And finally, there is the accuracy of apportionment. Apportionment will discuss which non-industrial contributors have contributed to permanent disability. If the apportionment is incorrect, likewise the value of the claim will be incorrect. Apportionment, like impairment rating, should be based on objective findings and accepted medical science. Did you know that the contents of the AMA Guides 5th edition are considered medical science or scientific knowledge? Next, we're going to do problem solving. We're going to take this opportunity to review the above points that I have discussed. So the question is this: what tools are necessary in the QME process to deliver accurate results to the stakeholders in California? Answer: a systematic way, collecting comprehensive, applicable, and meaningful data sets that objectively define the following. 1. A comprehensive injury map of the injured worker's data set. This includes the history, physical exam, diagnostic testing. 2. The QME has to determine MMI, maximal medical improvement status. Number 3. If the individual is found to be at MMI, a standardized approach to the impairment rating and the additional rating considerations of Alvarez-Guzman, Section 1.2 rating considerations, and Chapter 18 pain all must be addressed. Number 4, an objective approach to apportionment that's based on scientific knowledge, and then number 5, outlining any future care if indicated in the claim. Thank you for joining us for today's RateFast Speed Seminar, The Art of the QME. Please come join us at rate-fast.com and read our blog to learn more about accurate, consistent impairment rating and injury mapping. Or sign up for a free account today at rate-fast.com for accurate, fast impairment rating and injury mapping report writing. California workers' compensation made easy.